The breathing domain within the Decision Support Tool, DST, for NHS Continuing Healthcare, CHC assessment evaluates the extent of an individual's respiratory needs, including breathlessness, respiratory infections, and the impact on daily living. The purpose of this assessment is to determine the level of care and support required to manage their breathing difficulties effectively. Below is a detailed breakdown of the key questions that guide this assessment. What is the degree of shortness of breath, and does it occur at rest or only on exertion? Shortness of breath, dyspnea, can range from mild breathlessness on exertion to severe breathlessness at rest. It is important to establish mild cases. Breathlessness occurs only during strenuous activity. Moderate cases. Breathlessness occurs during routine activities, such as walking or dressing. Severe cases. Breathlessness occurs even when sitting or at rest, indicating a significant decline in respiratory function. The presence of severe dyspnea at rest may indicate advanced respiratory or cardiac disease, requiring continuous oxygen therapy, ventilatory support, or palliative care intervention. How does breathlessness impact daily activities? Breathlessness can significantly limit a person's ability to perform essential activities of daily living, such as walking short distances, climbing stairs, dressing and grooming, eating and drinking, speaking for prolonged periods, sleeping comfortably. If breathlessness leads to dependency on carers for basic tasks, it suggests a higher level of care requirement. Additionally, individuals with chronic respiratory conditions may experience fatigue, weakness, and anxiety, further reducing their ability to function independently. Are there recurrent chest infections, and how frequently do they occur? Chronic lung conditions, such as chronic obstructive pulmonary disease, COPD, bronchiectasis, or pulmonary fibrosis, often predispose individuals to frequent chest infections, including pneumonia and bronchitis. How often do infections occur, e.g., monthly, quarterly, yearly? Do they require antibiotic therapy, hospital admissions, or intensive care support? Do infections respond well to treatment, or are they recurrent and difficult to manage? Frequent infections requiring medical intervention indicate a greater healthcare need and may necessitate specialist respiratory management. What medications are required to manage breathing difficulties? The type and frequency of medication use can indicate the severity of respiratory impairment. Common medications include bronchodilators, e.g., salbutamol, tiotropium, to relieve airway constriction, corticosteroids, inhaled or oral, to reduce inflammation, diuretics, e.g., furosemide, for heart failure patients with fluid overload affecting breathing, antibiotics for recurrent respiratory infections, long-term oxygen therapy, LTOT, for individuals with chronic hypoxia. A person requiring multiple medications, frequent dose adjustments, or emergency interventions likely has a high level of care dependency. What respiratory treatments are in place? Respiratory treatments vary depending on the individual's condition and may include inhalers or nebulizers to improve airflow and reduce breathlessness, oxygen therapy, intermittent or continuous, non-invasive ventilation, continuous positive airway pressure, and BiPAP for conditions such as sleep apnea or respiratory failure. Mechanical ventilation, invasive ventilation via tracheostomy for severe respiratory failure. The need for advanced respiratory support, ventilators, continuous positive airway pressure, BiPAP, or oxygen therapy suggests high complexity care needs and may indicate the requirement for specialist involvement. Is specialist intervention necessary? Some individuals require ongoing monitoring and management by specialist healthcare professionals, such as respiratory consultants, pulmonary rehabilitation teams, palliative care specialists, cardiology teams for heart failure-related breathlessness. Specialist input is crucial for those with progressive respiratory conditions that require complex interventions, regular assessments, or palliative care support. Can the individual lie flat, or do they experience orthopnea? Orthopnea, difficulty breathing while lying flat, is a common symptom in individuals with congestive heart failure. Do they need to sleep with multiple pillows or in a recliner to avoid breathlessness? Do they become short of breath when repositioned in bed? The presence of severe orthopnea or difficulty repositioning may indicate stage 4 heart failure, which is often considered. Please share your thoughts in the comments sections below.